I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about food addiction. And last week we did a kind of neurophysiology of addiction, and it's on the website, drjoe.com, and we covered some ways to get the brain to start working more normally again, hopefully. And today we're covering specifically food. And the good news is that the brain can fix itself in many cases. What happens is the nucleus accumbens releases a chemical called dopamine. So dopamine is released, it's released into the nucleus accumbens, and it's absorbed by something called the letter D2 receptor. So these D2 receptors are downregulated. They basically shut down because you're putting too much stimulus into the body. And then what do? You want more to stimulate because the D2 receptors aren't working. Good news for you is D2 receptor population can grow back and start functioning normally again. So again, we always taught that once a brain cell was dead, it was dead forever. That's not true. The brain cells can regenerate, and the D2 receptor sites in the nucleus accumbens can actually heal. So that's really good news. So you can beat these addictions from a physiological standpoint, not just from a willpower standpoint. You're able to actually feel more reward when you look at the sunset. You have a relationship. You just enjoy people around you. Because people with full-on addiction have almost no joy and almost no feeling of reward or pleasure with anything. And I've met people in my life like this, and you're thinking, gosh, why don't they ever laugh? Why don't they ever have fun? Why aren't they ever enjoying anything? And the reason is their brain isn't capable of it. But once we start rebooting their body, the D2 receptor sites can heal, and the good news is you start to feel again. Sometimes good, sometimes bad, but you start to feel again. And that's what we talked about with earlier. If you've had trauma as a child, many times the body just wants to shut down. And so the body can heal and start to function normally again. Physical exercise, physical activity, really important. That promotes what we call neurogenesis and neuroplasticity. Neurogenesis, neuro meaning nerve, genesis meaning the beginning or growth. It's actually growing new nerves and restructuring the nerves that are there. So by exercising, you're allowing a more rapid healing to take place in your prefrontal cortex and then in your nucleus accumbens as well. So you got to stay in motion. And that's why I've pushed so hard. Now, I don't like going to the gym. I'm not a big fan of going to the gym. If I do a lot of heavy lifting, I've got an old injury in my neck that really, I almost died when I was 10 years old. I got hit by a car, landed on my head. So I can't do a lot of heavy lifting because this old injury starts to flare up. But you can go for walks. I can go for I like swimming. I like going swimming. I like to just do housework. I mean, I look at housework not as a chore, but as a form of exercise. I can mop, I can vacuum, I can do windows. Think of that, if you would, as this is my workout for today. I'm going to do a 20-minute workout, and you just clean a house. And that's fine, too. So find the one that works best for you. And we talked about epigenetics. These are things, outside forces that have an adverse effect on your genetics or a positive effect on your genetics. And if you're doing things like meditation, if you're eating right, if you're exercising, epigenetically, we can turn off the genes that cause inflammation. So this is really cool stuff. Dr. Bob Lipton, I think that was his name. Is his name, yeah. I've heard him speak, and he was one of the pioneers in epigenetics. And it's really cool stuff. I remember hearing it back when I was in college going, it doesn't make any sense. Now it makes a lot of sense. So your environment, what you do, chemically, physically, emotionally, the people you hang out with, can have an impact actually on your genetics, which is really kind of neat. So it kind of goes hand in hand. You got to get the chemistry right, but you also got to get the microbiome in your gut right. Right before I did the show, I was talking to Tina, one of my associates, and she said, what about microbiome? And I said, don't worry, Tina, we got to cover it today. Microbiome is the bacteria in your colon. And you have over 100 different types of bacteria in the colon. Some are good, some are bad. And they're always in a balance. We try to reach what's called a homeostasis, a balance. And we find that people that are fat, and again, I used to be fat, so I can say the F word, people that are fat have different types of bacteria in their colon than people that are skinny. And so if we can recolonate their colon with good bacteria, they can start acting like a skinny person. And extreme measures are actually something called fecal transplants, where they take the bacteria out of a healthy, skinny person and implant it in a fat person's colon. Personally, I think that's a little extreme, but studies have shown that the bacteria, the microbiome, that bacteria in your colon, has an effect on everything, including how much you eat. So healing through the body, reduce insulin resistance, decrease all the signs and symptoms of what we call metabolic syndrome, high blood pressure, high cholesterol, diabetes, belly fat. All these things can be reversed by doing the same thing. That's what's cool. You don't have to do one thing for diabetes and one thing for heart disease and one thing for addiction and one thing for osteoporosis. It's all the same thing. And so that's why when I did my show on heart disease, I said that a lot of researchers now believe that a probiotic, a good bacteria supplement, is more important than a multivitamin when it comes to heart disease. Now, I think they're both equally important, but the researchers are showing that we've got to get the bacteria in our colon right. And every year that I study, and I've been studying this for decades now, every year more and more and more research comes out on the importance of good bacteria in the body. Now, you can take a probiotic supplement, I do, every day, but you have to make sure you have something called prebiotics as well. Prebiotics are the food for the bacteria. They're food for the probiotics. And so where do we get prebiotics from? Fruits and vegetables. Another reason you want to be eating fruits and vegetables. In our supplement, Dr. Joe's Essential Source, we add prebiotics and probiotics. And so I take that every day, and I don't know how many times, I don't think I've ever done a show ever, or a lecture, or a program, or a webinar ever, where something in Super Greens and Essential Source wouldn't be beneficial for that person. And that's why Essential Source has over 73 different ingredients. And so that's why it's so important that I think you take that every day. It's a minimum supplement you should take every day. It's less than $1 a day, about $1 a day actually, somewhere right around $1. Well worth it. For what you're getting is crazy. You couldn't buy that many fruits and vegetables and eat them because they'd go bad. You wouldn't do it. You'd forget some days. This is already in a powder, and it has all the other stuff in it. So unbelievable what you're getting, the Essential Source and the Super Greens. But one of the many, many things that you can get a benefit from is building up the prebiotics and the probiotics. So again, you don't have to do different things. I've said many times the 3 things you have to have in order to obtain and maintain good health: normally functioning nervous system, normally functioning digestive system, good nutrition. That's the core of a good nutrition program, of a good health program. Now, sometimes you need injections, sometimes you need surgery, sometimes you need drugs. I'm not against that. But if we build that core of the nervous system, digestive system, and good nutrition, if we build that, chances are we're not going to need nearly as much or any. I always laugh when I go get a checkup. They'll say, what kind of medications you're on? I said, none. I'm like, no, like pills, like medications, over-the-counter, prescription, none. I don't take any. I'm like, it's just amazing. Now, if I have a severe pain, I may take a acetaminophen, but nothing on a regular basis, which is amazing. And when patients come in our office, again, I've been doing this for a long time now, it's so rare to have a patient come in that's not on a medication. Multiple. Number 1 is blood pressure medication. Number 2 is kind of a tie between diabetes medication and cholesterol medication. And then we have anxiety medication and bipolar medications. And no one really seems to be talking about the cause of the problems. They're always talking about the symptoms. Now, it's okay to cover up the symptoms, but then I also want to get to the cause as well. And that's why we work so well with doctors and hospitals all around the world, and we co-manage the cases with their patients because they don't know what we do and I don't know what they do. So we work together to manage that patient. So with physical activity, every step you take, every move you make is going to make a positive change from an epigenetic standpoint to affect the genetics, to affect how your body heals. Nutrition, no question. You absolutely can't keep hammering yourself with addictive products for which you say yes, and you say yes to feeling shame and guilt, of course, but you have to have the nutrition in order to make that better. You're going to substitute what I call false fixes with healthy fixes. Well, I'm going to have diet soda instead of regular soda. That's not a good fix. That's bad for other reasons. You want to replace it with healthy fixes. So if you're addicted to sugary soda, what do? Clear all the soda out of the house. Replace it with water, different types of water. Maybe you like seltzer. You can get a seltzer maker. I have one, a machine that makes seltzer. You can put pieces of fruit if you want to. If you like limes, if you like lemons, if you like watermelon, if you like cucumbers, and make it really attractive, but also make it very accessible. When you open a refrigerator, if you're like me, you're going to grab the first thing that's convenient. Right now, if you open my refrigerator at home, I got a big bowl of blueberries. And so when I open a refrigerator, I'm just like you. I want a quick snack. I want to get high. So I'll just grab a couple of handfuls of blueberries. Close the refrigerator. I got my fix. Because I learned as a child, and you did too, that the steps you have to take to get that reward. Open the refrigerator. Grab the junky food. Eat the junky food. Get high. So your brain says, go open the refrigerator. That's where you find your junky food. So even though I'm much older than, I've been a vegan now for 30 plus years, that was ingrained in me as a child. I came from a family of very overweight people. There was always cake in the house. My mother, her excuse was, if the oven is on, might as well bake a cake too. No sense of wasting all that heat. So instead of just putting a chicken in the oven, I used to eat meat, you put a cake in there too and some brownies. So then you have dinner, and then right before you go to bed, you'd have a glass of milk and cookies and cakes or donuts or brownies, whatever it was. And so I learned that's how you get rewards. It's a Pavlovian reflex. So we all have Pavlovian reflexes, and we just need to realize them and then override them. I'm going to open a refrigerator no matter what. If it's full of good food, I'm going to be in good shape because I'm only going to eat the good food. And what other things could you have? Well, you might have fruit in there. You might have celery sticks in there, which aren't really that exciting. You might want to have hummus available. I know the other day I just made a tofu egg salad. In fact, yesterday, I made a tofu egg salad. And so when I open a refrigerator, I can see that sitting in there, pre-made, ready to go. It's no eggs in it. It's tofu-like egg salad. Yesterday for lunch, I juiced a whole head of celery. See, that sounds exciting. Drank the celery juice. Makes you feel really good, by the way. And then I took the pulp, and I added a little vegan mayonnaise to it, some lemon juice, some salt and pepper, and I kind of made like a tuna fishy thing. So if I open a refrigerator and I see that sitting there, pre-made, ready to go, or I see a cookie, well, I'm going to eat that because the cookie isn't there. So again, you just have to start preparing for yourself. So some of the symptoms you might have if you have a food issue, if craving certain foods despite feeling full and having just finished a healthy meal. How many people do that? I'm so full. Boy, could I go for a brownie. That's a sign. Start eating or craving food and often eating too much more than you intended. I'm just going to have a little piece of cake and you eat the whole cake. Eating or crave food and sometimes eating to the point of feeling excessively stuffed. I ate way too many potato chips. Feeling guilty after eating certain foods. Sometimes making excuses about why responding to a food craving is a good idea. You know what? What's the best one? You say to yourself, you know what? I deserve it. I had a hard day. I had a rough day. Me and Garrett had an argument today, so I just need a glass of wine to relax. You're making excuses as to why you need that. Repeatedly and unsuccessfully trying to quit. Hiding the consumption of the foods. How many people have ever done that? Hide the food from someone you live with or your spouse or your loved ones because you don't want to get caught. Feeling unable to control the consumption of the unhealthy foods, knowing that they cause physical harm. And the big thing is the guilt. When you start having that guilt come in, that's when you start having problems. I shouldn't be eating this, so what do? This is an excuse I used to use. I'm going to eat it faster. So that I know I shouldn't be doing this, I'm going to eat it faster. I have a half a pint of ice cream in the freezer. What should I do with it? Well, I could throw it away, but if I eat it, then it won't be in the freezer anymore. And so then you eat the ice cream. And if you do these things, these are signs, Jeff Foxworthy said, you may be a redneck if, well, you may be a food addict if. And so if you're doing these things, I want you to consider that there's an issue. So completely avoiding junk foods almost seems impossible sometimes. Anybody have that feeling? There's no way I can avoid all this stuff. They're everywhere. It's part of our modern culture. And we talked about food science earlier, that there are certain foods that stimulate the pleasure centers in the brain, specifically a combination of fats, carbohydrates, and sugar. And when you do that, you want to eat more of it. If you walk into a diner, especially up in New Jersey, I think there's one here in Atlanta, whole case of what? Cake. Huge, mountainous cakes. And I've spoken to people that have eaten them and I said, they're not really all that good, but they're really pretty. And when you walk in, you go, ooh, at the end of the meal, I'm going to have that. And then the server says, all right, you guys ready for dessert? Right? It's an upsell, of course, and that's fine. That's capitalism at its finest. You ready for dessert? Well, what do you got? Well, let me give you an option. I'm going to give you this and this and this and this. And you say, that cake I saw when I walked in was really pretty. I think I'll have a piece. And what it is, it's fats and sugars. And those stimulate the dopamine receptor sites and the nucleus accumbens, and the dopamine is received by the D2 receptor sites, and you get high from it. And then you have a pleasurable memory of going to that place. Where do you want to go? You want to go back to that place again. So there's a whole science of making us buy more food. And as long as you know it's there, you then can make a wiser decision. Some cases, entirely abstaining from certain trigger foods has to be necessary. Perfect example would be alcoholism. How often can you drink? Never. So abstaining, sometimes all of it is something that has to be done. And once a firm decision to never eat food again is made, avoiding them is a lot easier. Cravings start to disappear. I went vegan many years ago. And the reason I went vegan was, yes, I wanted to be healthy and I understood the health benefits of it. But also I could have just been vegetarian. But what would I be eating then? Eggs and butter and cheese and yogurt, ice cream. So I had to make a decision not to just go vegetarian, but to go vegan, because I knew that those foods are in bad food. So if I pick up a bread and it has eggs in it, I can't eat it. It's done. If I was vegetarian, I'd say, oh, I can eat this. It only has eggs in it. So I had to go to the extreme because I knew that I couldn't trust myself. And so it's really important that we try to find out what we can do. And sometimes you just have to make a decision for yourself. I'm not going to eat animal products anymore. And that's the easiest decision to make because it covers a whole wide spectrum of foods that are addicting. Now, chocolate is not an animal product many times. Certain double stuffed cookies are not animal products. So it's not foolproof, but it really works well. Because when, like I said, I was in a car accident. I was 10. I played football. I played hockey. I have fractures, 2 fractures in my spine. So I've got a lot of issues. And I've got to be really careful what I put in my body because chiropractic care has saved my life. If it wasn't for chiropractic care, you and I would not be talking right now. Because I had so much pain. I remember shooting pain down my left leg. I'd play a sport, football, hockey, and I'd hold my left leg up against my chest and I'd cry in high school and then in college. And I would just cry. The pain was so intense. And through chiropractic care, I was able to manage that pain to tremendous results, to be pain-free. But more than that, if bones are out of place pinching nerves, they hurt, but they can also affect organs because the nerves that are being pinched affect organs. And also if the bones are out of alignment, they rub up against each other and they wear out. So I want you to consider if you have neck pain or back pain or shoulder pain or headaches, stop suffering. Why don't you come see us? I can't guarantee we can help you, but we would love to have you as a patient. And we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Then we also want to check your digestive system. Because one of the things I find if I eat too much, my stomach swells up and pushes up against my diaphragm. And then I know I'm full, but I want to keep eating. And so the only logical explanation I have for this is your brain produces a hormone called, your stomach produces leptin. Leptin is released into the blood, goes into the hypothalamus in the brain, and the hypothalamus says that I'm full. If my stomach is up against my diaphragm, I don't feel full, even though it hurts. My stomach hurts, but I want to keep eating. And then one of my doctors, and I've trained them all to do this, they take my stomach and pull it down away from my diaphragm, and my hunger cravings go away. It's amazing. When mine acts up, the first thing I know my stomach is acting up is that I start craving, I want to keep eating. And so I find when I get my stomach fixed, my food cravings go away. When I take the right supplements, Super Green's an essential source specifically, but omega-3 fatty acids for inflammation and vitamin D for the immune system and glutathione for the liver, I find that when I take my supplements, I don't have those food cravings. So again, when the body's hungry, it's not hungry for food, it's hungry for nutrition. And many of those addictions, when I dealt with addicts of all across the board, when I get their brain working because I give them the right nutrients and I stimulate the brain, they seem to be able to manage their addictions way better. Many times their total goes away. Because the brain needs oxygen, stimulation, and nutrition. So if the brain isn't getting oxygen, maybe you're hunched over all day. Maybe you've got a big belly, you're not breathing properly. Maybe you sit at a desk all day, you're not standing upright. That can affect oxygen. Stimulation, if you have a mindless job. Listening to this show is great stimulation for the brain because it's new things you've never heard before. And even if you've heard it before, you have to hear something about 11 times in order to memorize it. And so go to my website, drjoe.com. We have well over 1,500 hours of podcast, video, audio. Start listening to the shows. Listen to them while you're going for a walk. Listen to them while you're cleaning the house. Listen to them as you fall asleep at night. And what I'll do is I'll start to stimulate your brain. And the brain is more manageable when it's stimulated. And it also needs nutrition. So the brain needs oxygen, stimulation, and nutrition in order to have plasticity and neurogenesis. Neurogenesis, new nerves forming, plasticity, restructuring and rebuilding the brain. And so the brain needs these 3 things. And if you're not giving it those 3 things, it ain't going to work. And pain can override a lot of logic. So again, if you have pain, try to come see us. Let's see if we can get you out of pain. In most cases, you're going to be very happy with that. We have PRP available in our office. PRP is we take blood or fat, spin it down in what's called a centrifuge, and it separates out the growth factors. Platelet-rich plasma is what PRP stands for, by the way. So the rich platelets, the growth factors, we can re-inject into your body, and that can help reduce inflammation and then start sending healing white blood cells and other healing cells into that area to try to help regenerate. Works really well for torn muscles, muscle damage, tendon damage, arthritis. Again, no promises, no guarantees, but the research is very clear on PRP, how effective it is, and it's your own body. So it's not an outside drug or an outside stimulus we're putting in there. It's your own growth factors concentrated and then re-injected back into the body. Degenerative knees, folks, absolutely. I would strongly advise you come see us and we can do an evaluation for that and see if you're a candidate. Spine, really big on spine issues, of course, as a chiropractor. Muscle tears, and there's other things you can use PRP for as well. You can use it for hair restoration, which we're probably going to start doing later on. Not right now. Hair restoration, sexual decrease in libido for men and women. Many times we can take the stem cells and put them right back into the organs. Works great in many cases. Incredible what PRP is showing in research, and that's why I'm really excited to start offering that in the office. And if you call the office, you can get put on a waiting list. I think we're booked up the first couple of days, but we should be able to get you in pretty soon. Or you can go to the website, drjoe.com, and just send us an email too, and we'll get you on a waiting list. But we're talking today about addiction. I only have a few more minutes, but I did want to talk about the pain issue of addiction, because if you're in pain, you will eat sugar, and you will smoke cigarettes, and you will do illicit drugs, and you will do painkillers to try to override that pain. And that's where chiropractic care comes in. And in fact, they're launching a big campaign right now. I know the American Chiropractic Association, Georgia Chiropractic Association, and it might be in conjunction, I'm not sure, with the American Medical Association, of chiropractic for pain management. Because the opioid crisis is just out of control. I'll do a whole show on it in a couple of weeks probably, on pain addiction. And the opioid crisis is out of control, and there's no stopping it. Because once you start taking it, you can't just stop taking the pills. You go nuts. And so it's really hard to get people off these drugs. We're finding now that chiropractic and nutrition are things that we can add to somebody's protocol to get some really good results in most cases. So back to my food addiction, because we only have about another minute or two. Again, completely avoiding foods is an issue. Sometimes you can't because you have to eat. You can avoid heroin, you can avoid cocaine, you can avoid alcohol. You can't avoid food. So pros and cons. Make a list of the pros and the cons. I'm big on lists. I love writing things down. So pros, you might lose weight, you'll live longer, have more energy, feel better, have a better relationship with your family, your friends, your loved ones. Cons may include not being able to eat ice cream at a family party if ice cream is your addiction. No cookies during the holiday season. Having to explain your food choices. Years ago when I first went vegan, it was an issue. I would say I'm vegan and then I try to defend myself. Now, nobody's going to argue with me. And I say I'm vegan. Oh, really? Yeah. I don't push my lifestyle on anybody. They don't push their lifestyle on me. If they try to push their lifestyle on me, I just squish them like a fly. But I'm not really here to discuss that right now. Because there are times, like now, it's a great forum to discuss health, and there are times when it's not a good forum to discuss health. So if you do want to discuss health, if you have a health issue, neck pain, back pain, shoulder pain, numbness, tingling, if you've ever been in a car accident, ever, if the car was damaged, you were damaged, you want to come to see us as quickly as possible. The insurance companies know that the longer you wait, they have an argument saying, well, you weren't hurt. And that's an argument they throw out at a lot of people. So as soon as you're in an accident, come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. If you have other health issues, digestive issues, nutrition issues, pain, come see us. My phrase is stop suffering needlessly. So if you want to make an appointment, you can go right online, drjoe.com. You can book it right there or call us. The phone number's on the website. We accept most insurances, car accidents, sports injuries, Medicare. The first visit is usually $375. We've reduced it through the COVID issue to $149. That includes an exam, x-rays, consultation, first treatment, the next visit going over your x-rays, and doing a nutritional evaluation with you. All of that for $149. So if you want to do it soon. We can't do that forever. The website, again, drjoe.com. Follow us on Facebook and Instagram at Dr. Joe Esposito. I'm Dr. Joe Esposito. Catch you next time.
Thanks for listening to For the Health Bit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.